The Zika virus, you may have heard of it. It's been filling the headlines ever since it's began sweeping across Southern and Central America. Now it's begun to make its way to Northern America. The Zika virus is a mosquito-transmitted virus. It's related to the dengue, yellow fever, and West Nile viruses. The virus itself was discovered in Uganda in 1947. Until recently, no one on this side of the world has been infected. No one has developed the immune system in this part of the world to combat the disease, so it's been spreading rapidly. The infected may now number in the millions. That is expected to grow, as mosquitoes carrying the yellow fever virus reach all the way up to the Middle Atlantic region in areas of similar latitude, reach all the way up to the New York and Chicago regions. For most, it causes no symptoms or lasting harm. The concern is for expecting mothers and those who develop temporary paralysis. Due to the possible danger of the Zika virus and its potential to spread, it is important to raise awareness of the virus. We're going to explore the four major factors of the Zika virus: signs and symptoms, sexual transmission, dangers to infants, and the best ways to avoid contraction. The Zika virus does display symptoms. They can vary from very mild to very extreme. When present, symptoms often are pretty mild and last less than a week. They include fever, rash, joint pain, red eyes, and in some extreme cases, patients may develop Guillain-Barré syndrome, GBS. GBS is not exclusive to the Zika virus. This is when the immune system goes wrong and begins to attack the nervous system. Patients usually recover from a period of a few weeks to a few months. Different parts of the world are more likely to have outbreaks of the Zika virus due to the weather in the tropical regions of the equator. The more we explore the Zika virus, it is important to tell you that the virus is also spread by sexual transmission. Sexual contact should be avoided throughout pregnancy or should be avoided if either partner has been in a region afflicted by the virus. The CDC also recommends wearing a condom. The virus has been shown to remain in the testes for up to 2 months. It is unknown if the virus completely leaves the body. The CDC recommends up to 6 months waiting period before entering into sexual contact. Sexual contact can lead to afflicting a child during pregnancy. The Zika virus poses more of a threat to infants than any other group of people. It can cause microcephaly. This is unusually small heads in infants, and most likely comes with brain damage and other side effects. Although the link between the Zika virus and microcephaly has not been proven, there is an extremely strong correlation between affected areas and the number of cases of microcephaly. Cases have increased from between 1 in 5,000 and 1 in 10,000 to about 1 in 100 people, or births, I should say. Women in affected regions should be tested at least twice during pregnancy, regardless of infection. If it was previously thought that if infection was avoided during the first trimester, that it becomes much less dangerous. Fortunately, this is not true. If infected during pregnancy, birth defects can include sudden death in the womb, deafness, learning, behavioral, and mental disabilities. Health officials in Brazil, Colombia, Ecuador, El Salvador, Haiti, and Puerto Rico have suggested that pregnancy should be temporarily avoided. Strict use of birth control should be put in place. Obstetricians in surrounding countries have given similar advice. The fact of the matter is that the risk of fetal damage during the outbreak is way too high. Women should wait at least 8 weeks after testing positive or displaying symptoms before trying to become pregnant. Once infected and recovered from the virus, they will become immune. Now that we know the dangers of the Zika virus, we can get into the prevention and treatment. According to researchers in Maryland, there is expected to be a DNA vaccine available in the coming months for use. It is important to take whatever steps you can to avoid mosquitoes. Unfortunately, there is no vaccine or antiviral medication currently for the Zika virus. Ways to avoid mosquitoes include strong bug spray, nets, lamps, and other kinds of repellent. It is important for expecting mothers to avoid sexual contact with any infected partner during pregnancy. Also, they should avoid areas where contraction is more likely, typically more tropical regions. If you're going to an area where the Zika outbreak has occurred, it is recommended that you get a blood test done in order to be diagnosed. The information This information is becoming more and more important as the Zika virus makes its way to North America. The Zika virus is not a complete unknown. There have been many outbreaks in other parts of the world along the equator where mosquitoes are more likely to occur in puddles and pools. That's why treatment of those waters is becoming increasingly important in regions with large amounts of human population. Due to its unseen nature in this part of the world, we should keep in mind the signs and symptoms, sexual transmission, dangers to infants, and the best way to avoid contraction. It's really important to keep this information in mind because as the virus makes its way to more and more dense populations, it's going to become more easily spread through sexual contact or again through mosquito pools and being bit. Information is key, and awareness is also key. I hope what I provided will help to keep everyone happier and healthier in the coming months. Hopefully a vaccine will become available soon.